Do you know what diabetes is and how it affects your body? Diabetes is a chronic medical condition where the body struggles to regulate blood sugar levels. Picture your body as a car engine. Glucose or sugar is the fuel that keeps it running. Now imagine the fuel not reaching the engine properly, causing it to either overflow or run dry. That's what happens with diabetes. Too much or too little sugar can cause a cascade of health issues. It's vital to understand this disease, as it's not some rare, obscure condition. It's a common malady affecting millions across the globe. From the bustling streets of New York to the quiet lanes of a small town in India, diabetes is a global health concern. So, why should you care? Because knowledge is power. The more you understand about diabetes, the better equipped you'll be to prevent it or manage it effectively. Now that you have a basic understanding of diabetes, let's delve deeper into its types. Did you know there are mainly 3 types of diabetes? Let's dive right in. The first one is type 1 diabetes. This is an autoimmune condition, which means the body's immune system mistakenly attacks and destroys the cells in the pancreas that produce insulin. Without insulin, our bodies can't regulate the amount of glucose in our blood. Next up is type 2 diabetes. This is a condition where the body doesn't use insulin properly. Some people can produce enough insulin, but their bodies resist its effects. In others, the pancreas may not produce enough insulin. Either way, the result is the same. Too much glucose stays in the bloodstream. Lastly, we have gestational diabetes. This type only occurs during pregnancy, usually around the 24th week. It often resolves after giving birth, but it does increase the mother's risk for type 2 diabetes later in life. Knowing these types can help identify the symptoms and manage the disease better. Speaking of symptoms, what are some signs that might indicate you or someone you know has diabetes? Let's dive into the common symptoms. One of the most frequent signs is increased urination. People with diabetes often find themselves heading to the bathroom more often than usual, especially at night. Another symptom is an unquenchable thirst. Despite drinking plenty of fluids, the thirst simply doesn't seem to go away. Unexplained weight loss is also a common symptom, even when eating habits haven't changed. Feeling unusually tired or fatigued is another sign you might want to pay attention to. This occurs due to the lack of sugar in your cells, leaving you feeling exhausted. Additionally, blurred vision can be a symptom of diabetes. High blood sugar levels may cause fluid to shift into the eye lens, affecting your ability to see. Lastly, slow healing of wounds, particularly on the feet, is another symptom associated with diabetes. Recognizing these symptoms early can lead to timely diagnosis and treatment. But what causes diabetes? Ever wondered what causes diabetes? Let's delve into the reasons behind this common health condition. For starters, type 1 diabetes is often rooted in genetics and linked to certain infections. Researchers believe that a combination of genetic susceptibility and environmental factors trigger the body's immune system to mistakenly attack and destroy insulin-producing cells in the pancreas. Moving on to type 2 and gestational diabetes, these are often associated with being overweight or obese, lack of physical activity, and yes, genetics also play a significant role. In these cases, your body doesn't use insulin well, leading to an insulin resistance. Over time, the pancreas can't produce enough insulin to keep blood glucose levels normal, and voila, diabetes sets in. Gestational diabetes specifically occurs during pregnancy when hormones cause the body to become resistant to insulin. Post-childbirth, it usually resolves but increases the mother's risk of developing type 2 diabetes later. While some causes are out of our control, there are ways to manage and treat diabetes. So how can diabetes be treated and managed? Well, treating and managing diabetes often involves a combination of lifestyle adjustments and medication. A healthy diet is crucial in this process. Consuming balanced meals, rich in fruits, vegetables, and lean proteins can help keep blood sugar levels stable. Regular physical activity is another essential pillar of diabetes management. Exercise helps to regulate blood sugar levels and promotes overall well-being. It could be as simple as taking a brisk walk or cycling around your neighborhood. For some individuals, lifestyle changes may not be enough. In these cases, medication or insulin therapy might be necessary to control blood sugar levels. It's important to remember that everyone's body responds differently to treatment. What works for one person may not work for another. Therefore, personalized advice from a healthcare professional is vital. Remember, with the right knowledge and care, diabetes can be managed effectively. Always consult a healthcare professional for personalized advice.